Hi everyone, welcome back and happy Friday. So we're going to continue with the reproductive systems. Again, we're here unlisted, but when I post it, like so far so good. I'm hoping the YouTube auto moderators don't age restrict things. But the good thing is it stays up, but sometimes you might need to sign in if they do age restrict things. Alright, so let's continue, and you might want to boot up your top hat because we have a lot of interactive questions today. So we're going to finish up the male reproductive system and go on to the female reproductive system. Alright, so let's see. So we finished off talking about sperm, and let's talk about sperm quality. So the thing is that what we have here is like, okay, we have the head, the mid piece of the tail of the sperm, but notice that there are many different shapes. And the thing about when a typical let's say a male about 20-ish years old, just under 60% of the sperm that are produced are actually alive. So if you look at a sperm sample, I actually should have included a visual of the looking at the microscope slide. Like only 60% of them will be moving. The rest are dead in the water. So maybe around 40%, or actually, some might be alive but not even moving. So only 40% are actually moving around in a typical sample. And about normal sperm, so the thing is that sperm come actually in many shapes and sizes, and the thing is that normal sperm are about less than a quarter of sperm are actually normal in shape. So there's actually many different shapes that you can find in a sperm sample. So here we have like a really big head, and here we have two heads, a small head, and then sometimes double tails, and then it's like abnormal middle piece. So just like, yeah, so far from the majority of sperm, and that's why there's so many sperm are produced, because again, there's like more for like quantity over quality in terms of producing sperm. Now, the thing is that many things can affect the quality as well. So again, it's like if with that much sperm, that's not very good quality, but things like xenobiotics, that are things that are foreign to your body. So taking things like alcohol, cannabinoids, and smoking byproducts, these can lower the normal sperm count in a sperm sample. And stress as well. So this thing is like, if a male is having fertility problems and they want to like have a baby with their partner, then it's like, okay, maybe it's stress, maybe it's like drug use or xenobiotic, and it's not necessarily just recreational drugs, but other drugs can affect that as well. And nutritional deficiency, because again, these are living cells, and if you don't have enough nutrients to supply them, then that can also affect fertility as well. And this is also very interesting too, excessive heat. So if you have too many of the thing about the sperm is that they thrive at an optimal temperature, but the thing is that they're also stored at optimal temperature too. Now this is where you have to talk about like what is the normal temperature, or what is the optimal temperature for having or for the sperm development. So it's actually 34 to 34.5 degrees Celsius. Now again, the average, and again in most textbooks it says the average is 98.6 Fahrenheit, but notice that this is appreciably lower than that. And why is that? Remember, the testes hang and they droop inferior compared to the penis, right? So they're away from the abdominal cavity and pelvic cavity, so they're away from the trunk of the body, so they're further away from the body and the heat. So again, this is why the testes have a lower temperature than the average body temperature, because of that distance and being connected by those spermatic cords that allow it to move further away from the body. So this is how the testes are able to maintain temperatures. Or you might know, if you're male and you notice like in cold temperatures, what typically happens? The testes end up going closer to the body, and this is why like the scrotum and the creammaster and the muscles in there, that's why they move it closer, because they're trying to maintain, so again, moving closer to a warm object warms you up, right? So same with the testes. If it gets too cold, then it's going to move closer to the body. If it's too hot, it's going to move further away from the body. So again, this is why the scrotum exists, and there are two primary muscles that control this elevation or depression of the testes away from the body. So there's the Dartos and there's the Creammaster, and they're both involved in maintaining this optimal temperature for sperm development. And the Creammaster, so this is the part you see surrounding the spermatic cord over here. And the Dartos is actually hard to see in this image, but it's kind of like it's a sheet of muscle that kind of follows the scrotum and the skin, or underlies the skin of the scrotum. Now the Dartos muscle is again kind of hard to see visually, and maybe there's a better dissection image somewhere, but what it is a layer of smooth muscle, and again, smooth muscle is involuntary. So this is something you don't control. So what happens is like contraction is going to cause corrugation or wrinkling of the scrotum. And what does that happen? Again, contraction, whenever something, a muscle contracting, is going to shorten and shrink. So this is going to decrease surface area. And why would you want to decrease surface area? Well, the more surface area you have on your body, the more you lose heat. So by bringing things closer together, like this is why like when you're cold, you might do this as well. You're kind of decreasing the surface area that's exposed to your environment. So if you're in a cold environment and losing heat to the environment, you're going to decrease the exposed surface area. Same with the dartos muscle when you have contraction. Now relaxation is going to do the opposite. So that's going to smooth the scrotum. And the thing about that is it's going to increase the surface area. And why is that? Well, when you relax the scrotum, what happens is that you have more folds, and just like in the folds in intestines, the more folds you have, the looser the surface is, the more surface area you have. So the looser it is, the more surface area. And it's just like having loose clothes versus tight clothes. Like tight clothes are going to, like if you have loose clothes, that's more breathable and more airy and whatnot. So same with like this increased surface areas with the relaxation of the scrotum via the dartos muscle. So that is going to cool the testes. So this happens in hot environments. So I have a hard time finding a picture, but here's an analogy. So contraction of the dartos is going to cause wrinkling, and relaxation is going to cause smoothing. And again, if it was smooth, it would actually have like more smooth, like a lot more folds here, but contraction is what causes that corrugation and just shrinking that surface area. So it's about like, are you going to decrease surface area to decrease heat loss, or are you going to increase surface area to increase heat loss? So that's the main function of the dartos. Now the Creammaster knows that it's running like this, so it's kind of lengthwise. So the Creammaster muscle is actually important in terms of like elevating and like lifting the scrotums up or testes up, or descending them and lowering them. So contraction is going to move them up like an elevator, so it's going to elevate the testes and bring them closer to the body. And why might you want to do that if you're trying to maintain optimal temperature in testes? Well, if it gets really cold, then you want to warm up these testes so that they don't get too cold and kill all the sperm. So this is going to warm the testes. And relaxation, what's that going to do? The exact opposite. So again, contraction shortens, relaxation lengthens. So if this starts to lengthen, that's going to cause the testes to descend. So this is going to lower them away from the body and then make them further away from the warm insides of the pelvic cavity. So the testes are going to move further away from the body, and the testes are going to cool off. And again, this is like, so what is it? Or is like, why is this so important in terms of sperm quality? Well, often like, especially like in Japan, they said like they love taking hot baths, and there's hot springs that people like to enjoy, and it's a social and recreational thing to go into the hot baths, but they're also way above normal body temperature. So they said like that's one possible contributing factor, is that they're taking too many hot baths. And if you take this, like if you're going to a 42 degrees Celsius bath, that's way above the normal temperature for testes. So that can affect reproductive health as well. Now, the Creammaster, there's an interesting thing called the Creammaster Reflex. So again, reflexes are involuntary. So reflexes are, you have some sort of stimulus, it goes to your central nervous system, and it causes some sort of response in a motor, or it actually can be like in an organ or a skeletal muscle. And the Creammaster is interesting because it's a mix of both smooth and skeletal muscle. So supposedly, like there's the Creammaster reflex is like if you stroke the medial portion of the thigh, this would call the Creammaster to contract. And I mean, I've never been able to elicit this. Like it's kind of, like you can't do it on yourself because it's kind of like trying to tickle yourself. But I mean, this is in textbook, but I've had a hard time finding a demonstration of this. But why is it important? Well, the thing is that complex movements, especially of the lower limbs and lower body, that can also cause the Creammaster reflex. So again, if you had, like, here's this guy on the pommel horse, and if his testes were not, the cool thing is that, like, during complex movements of the lower legs, that causes the Creamasters to contract. So that's going to lift the testes out of harm's way, because what happens if these testes were just that fully relaxed? Well, there'd be an increased risk of some sort of hazard and injury when he swings around those handles and pommel horse. Now, this is an interesting one. So, how was he able to do that? Like, I mean, this is like old school. Like, if you see some of these videos, like the Shaolin monks and whatnot, how is he able to withstand all that? Because typically, if a male encounters that sort of trauma to the testes, he's going to be doubled over. Or even if it's like a light tap, sometimes like if you've ever played like any sort of sports where you catch a ball, like especially baseball, that kind of, I think that happens to everybody, and that's why there you often have protective cups to protect the testes, because it would take you out for temporarily. So the interesting thing is that the Creammaster tissue is it's not just smooth muscle, but a mix of both smooth and skeletal muscles. So the cool thing is that pelvic floor contractions, because you have this voluntary control, this is probably, I mean, I'm kind of speculating here, but you can cause voluntary Creammaster contraction. So you can have voluntary contraction and lifting the testicles back up toward the pelvic cavity. So supposedly, I've heard, they say like in this, when the monks do that, they're able to actually move the testes back into the pelvic cavity, but I'm trying to look for like scientific journals that say that. I mean, maybe there is something, but I just have to like find it yet. All right, so then is it just about the testes? Well, and just about sperm quality? Well, they have more than sperm. So the thing about ejaculate, which is a mix of sperm and the seminal fluids that accompany it. So ejaculate is a fluid. So you have many glands that contribute to making that fluid. So you have the seminal glands, also called seminal vesicles. So I think you should know both, because seminal vesicles is also a very common name for this. And then there's the prostate gland, and when we talked about this briefly when we talked about the prostatic urethra. And then there's the bulbal urethral glands, aka Cowper's glands. And I think you should know that too, because it's also a very common name for those glands as well. Now, they do different things. So the seminal glands actually produce, or aka seminal vesicles, these produce the majority of the volume of ejaculate. So they produce the most of the fluid, and they make alkaline secretions. And why is this important? Well, if you have acidic urine coming out from the bladder, well, it's going to end up coming out the same urethra, right? It's going to end up coming out the same prostatic and spongy urethra. So if there's any acid left over, maybe it makes sense that you want to neutralize that pH. So this is why it's important to have alkaline secretions in the reproductive tract. There's also fructose, and this is a type of simple carbohydrate, it is a type of carbohydrate that helps with helps fuel the sperm and provide nourishment, so that because again, they are going to use up energy as they have that mitochondria that spins around their tail and propels the sperm forward. And also prostaglandins as well. These are a type of signaling molecule, but just letting you know that it also produces that as well. So again, the majority of the volume comes from the seminal vesicles, aka seminal glands. Then there's the prostate, very important, but it doesn't produce the majority, but it does produce a significant amount. So about 30% of your ejaculate volume comes from the prostate gland. So it includes enzymes. And why is that? Well, there's many enzymes, especially at the cervix inside the female reproductive system. So these help with the transport of these sperm, and as they go from the vagina to cervix to the uterus and down to the fallopian tubes. And then we have also zinc that also helps with the composition of ejaculate. And then the bulbal urethral or Cowper's glands. So this is a very tiny amount. And they include things like more alkaline secretions, again, to neutralize any possible acid that's left over from urination, and also mucus and sugars, because again, you want things to kind of nourish the sperm, but also facilitate their passage throughout the reproductive systems. So all of these, like the composition of all the and secretions of all these glands, their overall goal is to help keep the sperm alive and nourish them so that they're able to travel toward an egg. Okay, so then real quickly, a review on endocrinology. So then what we have here with the hypothalamus pituitary, again, if you have a hypothalamus pituitary axis, it's always going to be hypothalamus first, pituitary, and then the gonads. So you have FSH and LH, but we're talking very briefly about the testes. So the HPG axis is in the here. Yeah, so for here we have androgens in the male HPG axis, and we're going to talk about this in a future lecture very soon. All right, so male reproduction, it follows this axis generally. So we have that first organ, the hypothalamus, that's going to produce that's going to produce GnRH, and that's going to stimulate the production of a pair of hormones. So we have FSH, follicle stimulating hormone, and luteinizing hormone, or LH. Then LH is going to stimulate those interstitial cells. So remember those seminiferous tubules and how they actually had cells that were outside of those tubules, and these are those late egg cells. So LH is going to target the late egg cells or the interstitial cells of the testes, and they are going to produce testosterone. So what we have here is a negative feedback. So if you produce too much testosterone, you're actually going to shut off production of GnRH, which would shut off production of LH as well. And actually, this is a error that's not in the Martini book. Testosterone does a double sort of like negative feedback. So it's like applying brakes on itself at 2 points. So this is why you can't, like, even if someone is like taking, like, using testosterone as a PED, this is why they're going to have a drop in GnRH and LH and natural production of testosterone, because if you have all this testosterone here, it's going to do negative feedback and suppress the production of testosterone. That's why a common side effect of using PEDs and anabolic steroids is a shrinkage of the testicles, because again, you're doing a double negative feedback loop if you have high levels of testosterone. Now those nurse cells, and again, the nurse or Sertoli cells, they don't become sperm, but they also produce something called androgen binding protein, which is going to glom onto androgens and also prevent them from having their effects. But they're also going to produce another hormone called inhibin, and inhibin is also found in the female body as well. But inhibin does what it sounds like. It's going to inhibit this whole axis. So if you have a lot of these FSH or LH that's going to produce, or if you have a lot of FSH especially, that's going to inhibit the production of GnRH and FSH. So what we have here is you have too much of these hormones over here, you're going to inhibit the production of androgens. Okay, so then we have to talk about a little about hormones. So primary and secondary male sex characteristics. So what are primary male sex characteristics? They're internal genitalia and external genitalia. So the reproductive organs you can see on the outside, and reproductive organs that are located on the inside of the body. Those are your primary male sex characteristics. The secondary ones are the ones that develop as a result of endocrine and male sex hormones. So what are secondary male sex characteristics? Well, these are the characteristics that happens when the male undergoes puberty. So broadening of the shoulders, and then narrower hips and a pubic angle, and then what we have like increased muscle mass and bone density. So again, this is like, this is why you might have increase in facial and body hair, because again, like before puberty, not too much hair, but once you get puberty, then you start to have the development of like axillary hair and pubic hair as well. And increased sebaceous gland secretion. So sebaceous glands are those oily glands. So this is all these things happen during male puberty, and this is all due to the surge in hormones. And a larger larynx, so this is why the voice changes and like it deepens, and this is why males undergoing puberty, they also have that voice cracking as well. So it's all due to that increase. So the androgens, they play a very important role in the secondary male sex characteristics. Now, what happens if you don't have these androgens? So, or actually, like this term referring to this overall development of secondary male sex characteristics is virilization. So, say there's something happens in a female who ends up having an abnormal production of androgens in her body. Well, what's that going to do? That's going to cause virilization. So sometimes that happens, like, especially there's like condition called polycystic ovary syndrome, which can result in an abnormally high production of androgens. That can cause all of these in biological females, because androgens are important for this development of these characteristics. But what if you have a lack of these androgens? Well, one way this was artificially done is, so this is poor quality, but what is this? Someone's singing here, and the person singing here is Alessandro Moreschi. So born a male, but what happens is that he is the last of the Sistine Chapel castrati. So castrati sounds like castration, and if you don't know what castration is, you're going to find out. So castration is the surgical removal of these testicles. So what happens is, like, if you don't have the testes, and the testes are the ones that are producing testosterone. So if you remove the testes, what happens? You don't have androgens, and so yeah, if you have a castrati, you're not going to be able to produce sperm. But what happens is that they lost the people who were castrati, they wouldn't have the. So it's kind of interesting. Like, it was like, okay, they have some of the male characteristics, but this is why he's able to hit the high notes, because he was able to, the larynx wasn't enlarging. So by removing the testes and androgens, what happens is that these castrati also, they didn't look like, they didn't develop facial hair, they didn't have like, yeah, they had this narrow larynx, so that's why they're able to hit those high notes. And they also had different muscle composition and bone density, and yeah, it's so they, I should see if there are any modern castrati, but yeah, that's why back then they sometimes would want, if it's a boy had a really good voice, maybe they would say like, okay, let's, and it wasn't like a punishment. It was kind of like saying like, oh, these castrati were famous because they were like really great singers. But yeah, so it's showing like androgens play a very important role in the secondary characteristics, but the primary are the genitalia, internal, external themselves. Now, how much sperm is produced by a male? Well, per day, 250 to 300 million sperm cells per day. Yeah, so they're maybe about 40 million sperm cells per ejaculation. So how many sperm are needed to fertilize an egg? Again, remember that maybe a quarter of these sperm at best are actually normal and motile. So what's like, what if you take a quarter of 40 million? That's still 10 million. Do you need 10 million sperm to fertilize an egg? No, you just need one. This is just one half of a set of chromosomes interacting with another half. This is all you need to make a new combination, what we call a zygote, and a full set of chromosomes that could potentially develop into a baby. Now, with male fertility, a little statistics. These are the birth rates per man. Yeah, so this is like back in 20 years ago already. Okay, so this is birth rates per 1,000 men in the U.S. and what we see is like, okay, the birth rates per male. You see the peak around here, like around maybe the late 20s to early 30s, and then it starts to drop off toward 55 and older. Now, even though it's approaching zero, does that mean that males over 55-year-old are infertile? Well, thing is that yes, male fertility does decrease with age, and yes, actually male testosterone decreases with age as well. But the thing is that yes, okay, the healthy sperm count is kind of like very rickety to begin with, like again less than 25% in the best case scenario, and this percentage decreases with age. But there's like also increased abnormal sperm. So you saw those sperm with like big heads, small heads, like double heads or double tails. There's an increased amount of those in older males. And then how many sperm are needed to fertilize an egg? We'll say like it drops to 1% in like our normal. You still have like about 40 million, or say it's like the sperm count drops per ejaculate drops to 10 million. That would still be like 100,000 sperm that are potentially viable, right? If it's 1%. So again, you just need one sperm per egg. And why did I bring that up? Because like back when I was growing up, like there was like a girl down the street, and I think maybe at like 15 or 16, like she was slight in frame, and she didn't know she was pregnant, like that trashy TV show from that was on TLC a long time ago. But yeah, she gave birth without knowing that, and her excuse was we only did it twice. So it's like you just need one sperm to fertilize an egg. Doesn't matter how many times you do it. As long as you have like a normal sperm and a normal egg, then you could potentially have a baby. So this is why it's like, this doesn't mean like even though sperm count drops with age, if one just makes it to the finish line, then you have a potential pregnancy. All right. Now, and another example of this, you probably know this, like this guy probably looks very familiar, Charlie Chaplin. So again, like even I haven't watched any of his films, but old silent film star. Now he was born in 1889, again a long time ago. But what do these two men have in common? Well, the interesting thing is that they're related. So this is Christopher Chaplin, and is he Charlie Chaplin's grandson or is he his great-grandson? Christopher Chaplin was born in 1962. Interesting thing is that Charlie Chaplin was a father at 73 years old, with his wife who was almost half his age. So a 37-year-old wife and 73-year-old father. So Christopher Chaplin is actually Charlie Chaplin's son. And another interesting example, here we have Mick Jagger, 8th child at 73. So again, even though fertility drops as males age, he still was able to get a third or eighth child in this case. And this is his partner. I don't think they actually marry. I think they're just partners. But yeah, Melanie Hampshire, so 1986. So there's definitely age gap there, but it shows you like, yeah, even though the amount of births per male, or like in terms of like the age of the father, it drops off near 55. It's not a 0% chance. And this one is kind of sus because like claims to be the world's oldest new dad, and I don't know, I'm like, where's the DNA test? Like it's like Maury is like, where are you the father? I don't know. So it's like could happen, but I haven't seen any medical journal that really confirms this. And this one is another interesting case. Like they said, like 92 years old and becomes father for 13th time. So it's possible. Again, all you need is just one viable sperm and one viable egg, and then you can have a potential pregnancy.